Ooh, if I have things well set up. Okay, there we go. All right, so thank you all for joining today. Before we begin, I just want to take a moment to orient any of our new attendees to the Project ECHO platform. This platform aims to support case-based virtual learning that connects experts to public health officials, responders, and clinicians working in the field. And the ECHO model is built on the principle of all teach, all learn, where communities can learn and share together to promote best practices, share experiences, and access experts in the field. This learning series was awarded to Denver Health by the Robert Wood Johnson Foundation via the ECHO Institute, and we'll be holding sessions twice a month through September 2026. So we're reaching the end of the series, unfortunately, but excited to offer a couple more as we wrap things up. We hope to reach our Region 8 audience in Colorado, Utah, Montana, North Dakota, South Dakota, and Wyoming to strengthen preparedness and response. And we encourage open discussion, whether it's questions, comments, or relevant professional experiences in these sessions. So please feel free to raise hands, come off mute, or put any questions or anecdotes in the chat. A couple of brief disclosures before we begin. This grant is funded through the Administration for Strategic Preparedness and Response, and the content is produced by the individual presenters and does not represent the official policy of the U.S. government. Additionally, this information is not meant to be a substitute for professional medical advice, diagnosis, or treatment. All right, and with that said, I'd like to introduce today's presenter. Erin Kelly is the Director of Practice at the University of Colorado Firearm Injury Prevention Initiative and faculty at the Injury and Violence Prevention Center and the Colorado School of Public Health. Dr. Kelly has over 15 years of experience in public health research and practice, specializing in suicide and violence prevention, firearm injury prevention, and upstream prevention focused on the social determinants of health. She has extensive experience in translating, disseminating, and supporting the implementation of evidence-based strategies, programs, and policies into community and clinical environments. And with that said, I will pass it over to Erin.
Perfect, thank you. Let me get my... I think you might have to stop sharing for me to grab that. There we go, okay. Presenting. All right, well, thank you all for having me. Because I can't see as well the chat in the video, feel free to interrupt me if someone has a question too, while I'm speaking here, but I'll leave time for conversation for all of us as well. I want to start simply by saying kind of what I am and what I'm not and what perspective I'll bring to the conversation. The first of which is that I am not a healthcare provider, but I have worked with many as part of my role in this. And so I want to note that up front of the individual conversations that I'll be talking about that are so important in preventing firearm-related harms or injury or death are something that as I have not fully experienced on my own as a healthcare provider. The other thing I would just want to caveat too is that most of my work, I know you're a regional group of people, has been focused in Colorado, but I'm still going to use a lot of the Colorado information to give examples of what's been done here, simply because that has been a lot of my center of practice. And if anyone is from outside the state, I'm also happy to talk with your states or your institutions about how to build out data infrastructure or something along those lines, which is what you'll see a lot from Colorado and has been a focus of my work for the past 5 years. So to start, I want to talk about just briefly where I am from, where I'm based within the University of Colorado, which is the Firearm Injury Prevention Initiative. We take a very neutral, non-judgmental approach to our work in partnership, especially with impacted communities, to be able to prevent firearm-related harms. We focus a lot on how to do these strategies within our households and also in the wider community. And whether that means research or as a lot of my focus has been is in really bringing that out into practice communities as well. My objectives today are to go over essentially the impact of firearm-related harms, to ground ourselves in kind of what the data say and why this is such an important issue in the United States, and then to go through some clinical approaches and resources that are available to you all to implement those, and then some community-based initiatives that I feel like you all can partner and support outside of the healthcare role that you have. So to start, let's kind of go through what I mean when I talk about firearm-related harms, or you'll use us have us use language around kind of injury and death too. But when I talk about harms broadly, the idea here is that I'm talking about either that direct physical impact of a non-fatal injury, or I'm talking about a fatal one of someone actually dying as a result of being shot with a firearm. Though I want to acknowledge, and I'll talk a little bit too about the psychological and emotional impact of also experiencing or fearing injury and how prevalent that is in the United States as well. When we talk about injuries, so either fatal or non-fatal, we generally classify these in three broad buckets, one of which is suicide. So again, here someone is it's self-injury and has the intention to die. One is unintentional shootings where there wasn't any evidence of it being intentional. And it could be against someone or oneself. And then there's a big bucket that we broadly refer to as interpersonal violence, which is this bucket of community violence, domestic violence, mass shootings, and also shootings that involve law enforcement. So where an officer has actually harmed a civilian in their line of duty. To start, to give a sense of kind of the iceberg of what this looks like in the United States, in 2024, we actually had 44,000 people in the US die as a result of being shot with a firearm. And there are almost four times as many injuries in the US as there are deaths. One of the stats that has made a lot of headlines is that firearms are, in fact, the leading cause of death among children and adolescents from the ages of 1 to 17, and it actually broadens all the way to the age of 19. So it's a major concern in multiple populations at this point in time. And then just noting that if you have survived a firearm related injury, that has such a lifelong impact on those who have survived, whether it's those physical mobility ones, cognitive functions, but then even broader than that, of mental well-being and PTSD or substance use, even how you can be employed and provide for your family. And then there's quite a few studies about an increased risk of re-injury involving firearms if you've actually been shot previously as well. So it continues to have this lifelong effect for those who have survived. I want to dig into deaths a little bit more here too, because generally speaking, people are often surprised to discover that 62% of those, so this is those 2024 deaths most recently in the United States, 62% of those firearm deaths were actually suicides. And so that is a big concern in the kind of firearm injury prevention research community in terms of what we're looking at. Over an additional third of those are homicide. And then I put a kind of decimal after this one because I want to note here that the officer involved shootings are actually 1.4%, and 1% of those were actually unintentional shootings. And generally speaking, I think a lot of people tend to think that unintentional shootings are quite a bit higher. And then, frankly, which would be classified here largely as homicide or within the suicide bucket, depending on the nature of it. But mass shootings are often assumed to be quite a bit bigger, and they would fall within those two buckets. But in general, the estimates around those is that 1% or less of the firearm related deaths in the United States are as a result of mass shootings specifically. So noting here again that a large focus for us is actually around suicide deaths that are involving firearms. Again, here, this kind of exposure beyond injury and death is something that's really important to talk about as well. So, in this kind of first bullet I have here, to most people, so about half of the United States, have actually said that they have had someone in their close social circle die as a result of some firearm involved incident, whether it be suicide, homicide, or this intimate partner violence piece in here as well. But noting these other kind of things that we don't actively talk about in when we think about these things, but that almost all public schools now, potentially private charter as well, have actually practiced active shooter drills. So children are exposed to the idea around protecting themselves against firearm harms. And then fear of mass shootings is preventing people from attending certain places or events or making other behavioral changes, changing schools, even moving locations in their neighborhood, not going to public festivals or using public transportation. All of these kind of economic and social, cultural impacts are all a result of fear around being involved in a firearm related incident. So when we talk about the impact of what's happening as a result of firearms in the US, the key part of the conversation we have to talk about in the US and why we have such high burden of morbidity and mortality in the United States is because of our high access overall. Um, One important thing that I want to make sure that we have as a principle of this and part of our really neutral and non-judgmental approach is that in the United States, the fact is that there are more firearms than there are people in the United States. And while I just talked about the burden of injury and death and these other exposures that go beyond those and have emotional and psychological impact, the majority of those firearms aren't used to cause harm. And so we have to approach this as like firearms are also used for a lot of other reasons. And many people who own and access firearms talk about the positive benefits of community and culture around having firearms as well in the United States. Um, though I note in here too that this access and kind of impact on injury is the key piece of what we focus on. So I want to say off the bat that it's not that people who own or access firearms are inherently more suicidal, violent, or careless or anything along those times. It is essentially that they have higher access to a very lethal weapon, and that is more likely to cause death or injury. So because of that immediate access that they have to this lethal firearm, it is linked to having a 3 times higher risk of suicide if there's a firearm in the household for adults and adolescents, a 2 times higher risk for homicide, intimate partner femicide, which is homicide against a female, is a 5 times higher risk if there is a firearm in the household at the time of a fight or aggressive behavior. And then again, a higher risk of unintentional injury overall. So again, our focus has largely been on those who access or own firearms because that increases the risk in these situations. So again, here for Colorado, we have been since 2023 administering a biennial survey of a representative group of adults in Colorado called COFIPS, the Colorado Firearm Injury Prevention Survey. Actually, apologies, this is the 2025 data, but 37% of Colorado adults reported having a firearm in their home. So again, almost 2 in 5. And then noting that almost 1 in 5 households had both children and firearms in the home. So that very kind of at-risk group around firearms, that's 1 in 5 households in Colorado. And then noting that 43% of those Colorado households kept all of their firearms locked and unloaded, which is a really good secure storage practice. But we're seeing under half of those households have all of their household firearms using that secure storage practice. I want to point out, and this is from the same survey, that because this is an important piece of not assuming that you know who has a firearm. I point out here that while some of these stats make sense of you would anticipate veterans or those who are white and live in rural areas to have a higher level of ownership, males as well, you still see these splits that demonstrate that there are a diverse, and we've seen, especially since the COVID pandemic, increases in women, those who identify as Black or Latino, all of those as owning more firearms. And so I think that's an important piece to recognize here from a practitioner perspective, that you shouldn't make any assumptions about who owns, because many people do, and for a lot of different reasons. There are particular high risk situations, some of which you kind of heard me refer to within here when someone has access to a firearm. Of course, around suicidal ideation, again, because that immediate access to a lethal weapon is such a key aspect of kind of our prevention work. Those who have dementia, when you have children in the home, those who use substance use, when you fear that there's domestic violence concerns, or when there's general kind of youth or community violence concerns within the broader neighborhood as well. And the reason why we're so concerned about these situations that I've mentioned is just the high lethality of those in suicides. The kind of case mortality rate is actually 9 in 10. For homicide, it's closer to 8 in 10. And then a key piece too, in terms of when we say, you'll often hear people say that the idea here is to create time and space between someone who's in suicidal crisis and the firearm that may kill them. That is because they can often make that decision to actually take their lives within minutes of when they think about it. So that access to this lethal weapon is a concern there. And then just in case anyone is like working with youth or interacts with youth, I have a couple of points in here around children as well, which is that most youth report knowing how to access a firearm quickly without an adult's permission. I'll actually give you specific data on this. And then often people say that, well, a younger child wouldn't be able to pull a trigger, and children as young as 3-year-olds are actually able to do that as well. So, which is why this is such a concern, particularly around unintentional injury with smaller children. Um, we also ask a few questions in the Healthy Kids Colorado survey, which is also a biennial survey now representative of youth in Colorado. And the idea here is so that we can tailor prevention efforts on reducing unauthorized access to firearms. We're cognizant of the fact that many younger people, alongside their parents, are out hunting or recreationally shooting as well. So the idea here is around this unauthorized access. Almost a third in Colorado reported that they had access to a loaded gun without a parent or adult's permission. Um, there hasn't really changed. There isn't a big difference, except to say that we also ask them the length of time it would take to ask them, and you see that there's increasing ability to access the firearm much more quickly among youth in Colorado who can access those firearms without the adult's permission. The key piece that I also say in here is that there's a big difference between essentially that what parents perceive about whether or not their children can access and what the children themselves actually say. And there was a dyad study which pairs an actual parent with their child. And essentially, those studies showed that 2 in 5 of the children in homes with parents who said that where the parents said that their child could not access that household firearm actually said that they could in less than 2 hours. So parents tend to think that it's very securely stored, and some of those children of those parents are saying, well, sure, but I know how to access it regardless of whatever they've done to securely store that firearm. So I'm going to shift into this idea around approaches to preventing firearm-related harms. And again, here I'll talk about kind of clinical setting in terms of when and how to help patients, and then also thinking around how you can do help efforts outside the clinical setting or connect efforts even. And noting in here too that there is no state or federal law that prohibits healthcare providers from asking their patients clinically relevant questions about firearms, which I think is a good premise for any concerns people might have about doing so. So a couple key pieces, because in our field, you'll generally hear me, and I'm going to talk throughout here about secure firearm storage. The term we at least use broadly to say that might actually mean storage within the household or actually storage outside of the household. And the whole concept here is that it can save lives by, temporarily or permanently delaying access to that lethal means. I do want to just say a little bit around how this is defined, because frankly, in the research and practitioner world around this, I think it's tricky because we all talk a little bit differently about what we mean by secure storage. In our world, the most important thing, and I think from a healthcare perspective, is talking about locking household. My slides keep automatically going. I'm so sorry, but locking household firearms, and that could either be a biometric, so that's the kind of fingerprint that's used on these, a key, or an access code. There are lots of other efforts that talk equally about having those firearms locked and unloaded. And the idea, as you add another layer, is essentially to continue to delay access in that time of crisis by adding more steps to being able. So this would mean you'd have to also load the firearm. There is also essentially a trifecta. The American Academy of Pediatrics talks a lot about this as an example, but where all of the household firearms are locked, they're unloaded, and that ammunition is actually stored separately than where those firearms are being stored. Um, but I make a note here, which is that when you talk with firearm owners, that and sometimes you'll get this across all of these secure storage pieces, that they find that to be impractical because the large reason why people own firearms, so about 75% report this in the United States, is because they want to protect themselves or their family or their household, their property, whatever it is, some their community as well. And so they actually want quick access to that firearm, which is why I think like biometric devices are increasingly becoming thing, and there's quick access locking devices that are all being developed as well. The industry itself is actually rapidly kind of coming around to this, but it's why we focus primarily on locking devices within secure firearm storage. Related to locking devices, and I do try to put some kind of QR codes here, and these can all be distributed afterwards as well. But when we talk about locking devices, we're generally talking about vaults and safes or just kind of these lock boxes themselves, which you see at the left. There's ones that actually attach to the firearms themselves, trigger locks and cable locks. And then again, biometric is still a type of a lock box or a gun safe, but has that kind of fingerprint access within it. Um, there is a secure storage one pager that talks about all of these things. The one thing I would say too, just from your perspective too, is that people often don't actually know how to use particularly trigger locks and cable locks on different types of firearms. And so we have actually created a how-to video that could also be a resource for distributing it if someone ever has a question about that with whom you're interacting as well. The other aspect of this that I had mentioned is this concept of temporarily and voluntarily storing firearms outside the home. This is often a bit more debated amongst folks in terms of what it is. But if there is ever a crisis situation or grandparents who have grandkids coming into town, we'll talk about this as being an option, and the parents requested there aren't firearms in the home, whatever the situation might be. There's lots of reasons why people would temporarily store their firearms. Generally speaking, there's all sorts of places that will do this, but firearm businesses and law enforcement agencies have been most studied. Our CU FIPE group has done a lot of work around firearm businesses that are willing to do this, and we actually have a national map here. I think you had to scroll down on this page, but that you can look up actual businesses that are able to provide on-site storage of those firearms as well. I put a Colorado note in here too, because while temporarily storing at a business or a law enforcement agency is an option, most folks actually prefer to hand over their firearm to a family or a friend that they trust with that firearm as well. This is where it highly depends on what the law is within it. But I will say, even with or without a law, I think this is a widely used practice where people will essentially let someone else hold on to their firearm for them. The biggest piece and the one that I think is most prevalent among the healthcare community is in terms of a role in a strategy that can be implemented within healthcare systems is broadly referred to as lethal means safety counseling, which lethal means here could also include anything around medication or drugs that might also increase risk for overdose as well. And so several of these also have those kind of like pieces within it of talking about overdose prevention and firearm injury prevention within it as a result of that. But I'll focus specifically on firearms as part of this. These are all resources that so bullet points, for example, actually is all about clinicians doing lethal means safety counseling. Secure Their Future is a Colorado branch of the American Academy of Pediatrics that has done a lot of work around working with, so for pediatricians in working with families. Calm is obviously suicide prevention training more broadly. two resources that that FIPI that I work with has created is Lock to Live, which is actually a decision-making guide that patients themselves can use, or a healthcare provider could walk them through to decide where they should be putting away any medications or drugs or firearms as part of that. And Firearm Life Plan is actually a tool that owners can use to really plan for what might happen to a firearm if they end up with dementia or cognitive impairments, or pass away, and what happens with their guns after that's the case. What are their wishes? Because those can become very difficult conversations for many families. While bullet points especially is a huge recommendation for me in terms of like thinking about how you did this, I am going to walk through just like a couple of steps around what this can look like in practice for a clinician. And we kind of say that there's like three basic steps. Everyone will break this down a little bit differently. But first and foremost is to provide the context and to ask, and then to subsequently, if you've been given permission to ask, I'll talk about what if you're not, but step two is to really move into asking about storage practices. So, like I'm actually a big piece in here is that I'm not asking about like, do you own a firearm or not? We're going straight to a storage practice kind of conversation. The step three then is subsequently to make a recommendation around what that could look like, dependent on what the kind of thing was that would have flagged for you as to why they should be considering securely storing. So, in this first step around providing context and ask, we actually recommend you say why. You're asking so that it makes the situation potentially less abrasive. And you also are able to normalize that you do this with many or all of your families that you're talking to about what might be the concern here. To very much focus the conversation around preventing injury. So again, not about like, I care about whether or not you own a gun or that. It's about like, I care because like this is actually pretty common and I want to prevent injuries. So I ask this question. And then again, in asking in a way that fits your role and your relationship with the patient, which is very kind of situational and context dependent and for something you all to consider. As an example of kind of what I'm saying here, it's a simple statement of many of my patients have firearms. So I ask the same question with everyone. Is it okay if I ask how those are stored? And what happens here is that they never say, you didn't ask about whether or not they owned. You went straight to, can I ask about how those are stored? If they say, I don't have any firearms, then you'd like, good to know. And you kind of move on with your other safety questions. You're integrating this within. Um, or they've given you permission to move into a storage conversation, or they ask you, why are you asking me? Which is also where you can kind of come back and say something of like, I care deeply about, or that it's actually more common to be injured or to die from firearms than you might think, which is why I ask these questions. So again, to kind of bring it back to that injury question. If you've been given permission to kind of move forward, or if they've become combative or anything like that, which is actually very rare from a lot of healthcare providers, you can simply say, thanks, I'll move on to the next question then, no problem. And it's always worth something you can send after the fact, any resources, as kind of a follow-up without having to have a conversation directly if you still have concerns. But if you've been given permission to move forward, you simply ask how firearms are stored. Then if there's other concerns around who can access them, for example, if you're concerned about children or a partner in the home, a person with dementia, then to specifically ask about whether children know where the keys are kept or that they know the combination. This is a key piece around that kind of split between parents thinking that they have them securely stored and children actually being able to access despite that. And then we make a note in here, which is to ask about items owned by other household members or visitors as well, because you might not be talking with the actual firearm owner either, which is a key piece. And we note in here too that like making sure that you reinforce a behavior if they all are already securely storing is just this really effective way to counsel and foster recommended behaviors as well within your conversation. In step three, in terms of recommending and providing resources, just needing to make the recommendation very clearly connected back to the access or connect it to the access concern you identified. So whether it's that's you're concerned about someone having suicidal ideation, or there's a child in the home, or someone has dementia, you kind of refer back to that, and that's what you should base your recommendation off of. And then to open it up for their thoughts rather than assuming agreement and moving on is a key piece of engaging them and is a motivational interview tactic as well. When possible, and I know not all healthcare groups are able to do this, but some out there are working on this, really giving a practical resource is such a key piece. So that actually means if you have cable locks available, or if you're one of the groups that are able to kind of get actual gun safes out there, or local referral information. As an example of that map I talked about, if you're recommending temporary out of home storage, you can say, where do you live? Here's not necessarily where you live, but like here in this Denver metro area, there are 3 firearm businesses that are able to take your firearm. Since I'm temporarily or recommending temporary storage, here's where they are. Here's the phone number, something along those lines. And then again, leaving space for future follow up if it's a conversation that was an important one in the conversation you have. So, as an example, for someone, you could say sometimes when someone is going through a hard time, they store their firearms away from home, like with a friend or at a gun range or store. This is just temporary until they're feeling better. Is this something you'd be willing to consider? So, again, engaging them in this conversation. This is about someone that's concerned about a child in the home. So my recommendation is that you secure your firearm with a locking device so that your kids can't access that. Are there any that you would prefer or are familiar with? So engaging them in a conversation around locking devices themselves. Um, and as a basis for all of these conversations, we always say, because I think the biggest thing is fear that like someone will react adversely. But the idea here is that these aren't, there isn't a perfect script, despite me giving examples of what that looks like. But knowing that you have potentially contentious topics that you talk about every single day, the idea is to do it regardless and to kind of get something that you think will work for yourself and for your patients as well moving forward. One thing I just want to briefly mention about that is another option in Colorado, especially because you can petition for extreme risk protection orders in Colorado. And they're in about 20 or so states nationwide at this point, but I think the only one in your region is Colorado. But extreme risk protection orders, are designed to prevent external threats and suicide, essentially by temporarily restricting an individual's access to firearms during a time of crisis when they pose an immediate safety risk to themselves or others. So I bring this up because there is an option in addition to mental health holds or other pieces where if you have real concern about someone hurting themselves or making threats and potentially hurting someone against other, extreme risk protection orders are an option, at least in Colorado. There is actually a specific e-learning course available to Colorado healthcare and mental health care providers. It's online. There is a continuing medical education or CEU credit available for that too. And it essentially goes over how ERPOs work, what the process is like to petition or to file for one, and what would happen after the fact as well. It was created by our Colorado Department of Public Health and the Attorney General's office as well. So noting that there is a situation in a very immediate risk scenario that could potentially be used by healthcare providers as well in the clinical setting. I'm going to shift then to talk just a little bit about what can happen outside the clinical setting and how that can kind of be around communication. I gave an example around one of temporary storage in firearm businesses nearby as a good example of kind of connection too. But I'm pretty sure that in your kind of state region that there is actually only one and maybe a second group that is up and coming that is doing work around hospital-based violence intervention programs. And the idea behind these is that if someone comes into a hospital and has been injured as a result of a firearm or frankly violent incident broadly, this is not necessarily firearm specific, that a group of trusted messengers, which are typically community agencies who've done a lot of work and often have their own lived experience around firearm related or violence, and previous exposure are working to really break that cycle of violence and to support these individuals who come into the hospital. The key piece around these is this trusted messengers and community groups that have been working with these individuals or with at-risk communities for a long piece, and I can't emphasize that enough. So, noting here that I think some of these resources are around best practices. They'll especially talk about that role of the trusted messenger. These are really intended to be these wraparound services of where they meet them in the hospital, but they're really helping to kind of continue care after the fact from especially a kind of economic, social family perspective to really reduce further risk of anything happening. In the Denver metro area, the key group that's been doing this for a couple decades now and is working within three hospital in the Denver metro area is AIM, or the At-Risk Intervention and Mentoring Program within Denver youth programs. But this is the kind of key piece that intersects directly with hospitals to prevent those community violence concerns specifically. Um, there is also a broader kind of thing that's referred to as community violence intervention. And the distinction between the hospital-based violence intervention program and this is really that they're trying to reach people before they are actually injured as a result of this. So it's often working with at-risk youth, again, to really kind of provide these wraparound services to reduce any risks of involvement in violent acts. Or self-harm, frankly, is kind of an increasing focus of these ecosystems as well. Um, the other piece that many people hear quite a bit about that's happening in the community is actual collaboration between the health and public health systems and firearm businesses themselves. Colorado has the Colorado Gunshot Project as an example, and I'm sure several other states have been implementing Gunshot Project either at the state or local level too. But the idea is that those firearm businesses are actually providing suicide prevention education to their actual customers when they come in and purchase a firearm or any other kind of supplies as a result of that, so that they're hearing directly from folks in their community about the importance of preventing suicide as a result of that kind of increased risk due to firearm access. I've been part of, and CUFIP leads a wider effort called Pause to Protect, which is not necessarily suicide specific. It's firearm injury prevention specific, but is still partnering with firearm businesses to both enhance, so to go a little bit beyond just kind of an education focused message and also provide services that could really help support these individuals or families, which looks like providing on-site storage and helping to expand that or get it up and running within their firearm businesses, or also distributing actual locking devices for reduced or free rates among their customers. We're particularly focused on those in the veteran or active service members communities right now, or their family members. So several efforts that are attempting to really use this trusted messenger of the firearms community, those who own and access firearms, to really talk about this importance of secure storage in terms of preventing firearm-related injury. The other piece that you can't really walk away from a firearm injury prevention lecture about that's so important, and I think as you think about your role as healthcare providers in addressing social determinants of health, I emphasize the importance in preventing firearm-related harms as well, just given that these safer, stronger communities experience less harms overall, specifically, and that follows with firearm-related harms too. So we talk about how any of the work that you're doing around stabilizing jobs, housing, transportation are so important. Your work alone of investing in healthcare or childcare or education. Cleaning and greening is a big piece of a lot of built environment work, and it also has a lot of linkage to preventing firearm-related harms. So really making sure that we're building out and making our neighborhoods safer. Any of these kind of outlet density efforts around firearms and alcohol. And then again, kind of on the positive side of things, really building social connections and doing more pro-social work to make sure people feel connected and supported by their communities and their neighborhoods as well. That is all from me in terms of kind of a presentation here. I will stop sharing. but left my email there, and we'll open it up to discussion or questions.
And give people another minute or two to collect their thoughts if anyone wants to put anything in the chat or come off mute. I will also put our post-session survey in the chat if anyone would like to complete to inform some of our future sessions as well. But otherwise, we can give it a couple more minutes if anybody else had any questions.